if you look at successful people, they usually have a character trait in common. That character trait is pattern recognition. What I mean is that they have the awareness and understand certain patterns that tell them when it's a good time to execute, what they think is going to happen, when they should back out, whatever the case may be. But having the awareness of the pattern increases their chance for success. And I think in the physical therapy world, the movement world, the human body world, I think we neglect patterns because this guy, the human body, has certain patterns. And when we understand those patterns, just like the successful person in another profession, we can increase our chance for success and ultimately actually make it easier in doing so. So in this video, I want to really bring your awareness up as to human body patterns and essentially understand three things. Number one, movement expectations. Number two, movement compensations. And number three, movement solutions. So before we can discuss those three concepts, we need to really talk about the human body patterns. Now, movement is already challenging enough, so I want to use different analogies and non-movement related, so that way when we come back to the human body, it makes a lot more sense. So what I want you to do is imagine a Lamborghini and a smart car. And it doesn't really matter if you're a car person or not, I think you'll understand what we're getting at. So when I said those two categories of cars, Lamborghini, smart car, what it's subconsciously or consciously doing is creating expectations in your brain, right? Some of the expectations you might have for the Lamborghini might be that it's really expensive, it's really fun to drive, it's terrible on gas, right? And some of the expectations for the smart car are just the opposite. It's a more practical car, it's not as fun to drive, it's inexpensive, it's good on gas, right? So both categories create expectations. And these expectations aren't good or bad. It just depends on what your goal or intent is of buying or driving one of those cars. And so they're not good or bad, they're just expectations. And when it comes to the human body, there are certain patterns that create expectations. And those expectations are going to make your patient good or bad at certain movements. Now, what I'm getting at here is that the engine and the shape of the car are really dictating those expectations, right? You would expect the Lamborghini is gonna have a much bigger engine because it can go significantly faster. So how does this relate to the human body? Well, the human body has two main engines or foundations, if you will, and that is the rib cage and the pelvis. And the shape of the rib cage and the pelvis are going to dictate expected movement outcome. So what we will see as far as human patterns is we will see this angle here, the infrasternal angle, as being very wide, where it's greater than 90, so it would be like here, or very narrow, which is closer to what this is represented by. And what that's going to do is it's going to change the shape of the overall structure, and that shape change creates movement expectations. So this means that when we have a rib cage that is really wide and flared, and we're in this anterior pelvic tilt, right, which a lot of our patients are, it is going to drive them to be better at internal rotation, adduction, and extension. Why? Because how the femurs sit in the innominate bone in an anterior pelvic tilt is going to drive internal rotation. On the other hand, we could have a narrow ISA, the infrasternal angle that's super narrow, and that is going to drive certain expectations. Why? Because of the shape of the structure. So what they are good at is external rotation, abduction, and flexion, right? So the shape of these two foundations or engines of ours create movement expectations. So this means when patients come into you and you start to recognize the pattern that they're in, you are going to recognize their movement biases, right? What they're good at. And this is all by understanding patterns. Point number two, patterns create movement compensations. Now, let's jump back to our car analogy, and we briefly discussed it, but when it comes to our Lamborghini, you would not expect it to be good on gas. Why? Because of how it's built. Conversely, the smart car, you would not expect it to go very fast because of how it's built. Those same expectations are exactly what the structure of the human body is going to do. So when we have a wide infrasternal angle, someone that is very, very wide, almost this horizontal line, and they're in this anterior pelvic tilt, we already said they're going to be good at internal rotation. This means they're going to be compensatory in external rotation. They're going to have a hard time finding external rotation, abduction, and flexion, aka they're not going to be able to find space, right? Now on the other side, the ones that are more narrow, more of this and more in this posterior pelvic tilt, more of this hunched over position, they are going to compensate with IR measures, internal rotation, adduction, extension. Why? Because of how they're built, because of how the structure is. And again, understanding the pattern, the structure, how they're built, is telling you how they're expected to move and what they're not good at, right? And ultimately, our jobs as physical therapists is to get them good at what they're bad at, right? Because they're probably dealing with some sort of pain because they are compensatorily moving into that motion that they're not good at. So we use exercises to increase their movement variability to get them feeling better. Point number 3, patterns create movement solutions. So if we go back to our car analogy and think about the smart car, ultimately we know that it's not as fast as the Lamborghini, right? But could you make that smart car faster? Sure you could. You could alter the engine, you can modify it, you can add things. There's ways to make it faster, right? So you're changing the structure a little bit to get an outcome that you're looking for. But when it comes to the human body, now that we're starting to understand patterns, when your patient comes in day 1 for their assessment, instead of looking at their pain point, right, their shoulder, you need to think globally. What's the pattern? Start recognizing these patterns. When you understand, are they in this wide pattern, the pattern that's more this anterior pelvic tilt, flared rib cage, or are they more in the rounded over, the no butt syndrome that I like to call it, right? And based off that, you already know what their biases are, how they compensate. You use your assessment to confirm or deny, and then from there, you don't guess. Why? Because we have the solution, right? You understand the solution. You're not guessing for the solution. You're taking and understanding patterns, and then just like we did with our car, we need to make a little bit of a tweak. We need to do that with our patient. Why? Because they're coming into you and they need to get faster, but we need to respect the structure, right? So when we don't guess, we actually get results, right? And instead of putting everyone through the same thing, we get very specific based on the pattern that they're in. So patterns truly create solutions because we now know exactly what needs to be done to get the outcomes that we're looking for. So I hope you found this video valuable, and I really encourage you to start to recognize patterns. Why? Because I truly think it simplifies human movement, but not only that, it starts getting your patients better results. Why? Because we're not guessing. We understand what's going on, so then we know exactly what to do to get the outcome we're looking for. And so if you want help with that, if you really want to dive into understanding patterns, then I would encourage you to check out our Performance Redefined course. This is an online, self-paced, lifetime access course where we dive into all of this discussion in a lot more detail over the course of 8 modules, and we go through comprehending it, assessing it, choosing exercises, and how to program. So I will leave that in the link below. Feel free to ask me any questions, but thank you so much for watching. I hope to see you inside the Performance Redefined course.